I'm Garth Gibson. I'm the president and CEO of the Vector Institute. You are here for a 1-hour talk. The purpose of that talk is to better understand the contact tracing debate, in particular in the context of the MyTrace app, which is going to be presented to you by Alán Aspuru-Guzik. We hope that you'll get a better understanding of what the problem is, what its main design and features are, and through our discussants, primary discussants, being Ashleigh Tuite, who's going to talk for public health, Nick Beamster is going to talk for technology, and Brenda MacPhail is going to talk for civil rights, some of the key issues, and generally give you a pointer to some cool new technology, which is being offered as a help to our public health in the battle of COVID-19. So I want to first introduce Alán. Alán Aspuru-Guzik is a professor of chemistry and of computer science at the University of Toronto. He's a member of the Vector Institute's faculty, and he's a CIFAR Lebovic Fellow for Biologically Inspired Solar Energy Program. He's also a Canadian CIFAR AI Chair and a Canada 150 Chair in Theoretical Chemistry. He's also been deeply involved in startup companies and is either an officer or an advisor to about 3 of them. At the moment, I'm sure he's got a few others on the go. Comes to us from a time period at Harvard, before that Berkeley, and before that Mexico. So Alán, I'd like to pass this over to you and give you 20 minutes to launch us off an understanding of the MyTrace app.
Thank you, Garth. Allow me to share my screen. This is going to be about a 20-minute presentation to try to cover important points related to the MyTrace effort. Present. Can people see this?
I can.
Okay, perfect. So the MyTrace effort is a grassroots effort supported by several organizations. Some of them are shown over there. I am a member of the Vector Institute of the University of Toronto, and also CIFAR has backed us up and gave us also already some financial support for this, and they are supporters of this app. I want to start just by showing you a little bit the structure of our organization, and also to give kudos to Samaila Morgan-Chan and CU Google, which are also panelists and be helping me answer questions. They are my 2 lab members at the Matter Lab at U of T. They have been basically executively running all of this. So these are the people that are running MyTrace. We have a coalition that kind of was assembled a little bit like the Lord of the Rings as you're going up through the adventure, you know, collecting different partners that have been amazing in making this possible. The main ones are listed over here. 24/7 Labs helps us with UI, EQ, security. Quarantine or 40N is helping us develop one of the view traces, trace views that I will discuss. And we join with the Open Tracers, a great team of medical school students and faculty that are giving us a lot of medical advice. We partner with Flatten, which is another Vector Institute kind of related effort, and Empower Health has been amazing as well. So I just really wanted to give you a heads up that this is not just me or a small team. We are about 50 people already in all of these organizations, and that's kind of how we are organized. We also have a lot of advisors, including Vivek Goel, Alan Bernstein, and many others that are helping us, you know, guide this. So we'll begin just by motivation. Then I'm going to move on directly to aspects of the technology and privacy. And then I would like to show you a couple demos and explain a little bit how the workflows work. And then, of course, we're going to move on to the other panelists. So why are we doing this? To get out of this, we need to do treatment, testing, and then tracing. This is kind of like the 3 T's of this process. Okay, so we are involved in the last one, tracing, okay, which of course combined with a lot of rapid testing can allow us to, whenever we have a low number of cases in society, and one pops up, figure out who that person was in contact with and be able to track them down and then advise them on what to do so that the rest of society can be out. And as you know, there's a big warning of having, second or third, reincidences, as we've seen that in many countries, due to this spread of the virus again. So So manual contact tracing is what has been used in many jurisdictions for a while, and it's very successful, right? It's something that works. You contact a patient that, for example, has been diagnosed positively, and then you ask them questions about where they have been, the contacts, when did the symptoms start, and then the contact tracers follow this tree of contacts and start trying to talk to the people that could potentially have been exposed. So that's one protocol that, again, has worked around the world. On the other end of the spectrum, you can imagine having a digital approach to this, where you basically record the locations of the users. We will discuss the privacy issues of how to do that the most private way possible, and the close contacts with other users. And then if somebody is verified positive, then the users can be notified and given some sort of risk assessment. And what you see on the right is a recording of a trail by Tika, one of our team members, when he went running in Toronto from our app. So there are pros and cons, of course, for the different approaches. I think the panelists will touch more on that, and we'll go on Q&A on this. But of course, manual contact tracing works, and it's a human element. But of course, if you have a lot of cases, things you might not remember exactly where you were, and it's very slow. I mean, one of the patients in Korea infected 1,000 people. Okay, so it's very hard sometimes to just follow the entire tracing. Digital contact tracing has a lot of benefits, right? Because all of us, many of us, have smartphones, and you can combine the data that comes out with AI and other different type of tools. You can identify public spaces and then act upon them, and it's automated. Obviously, one of the biggest elephants in the room is the privacy concern of imagining a big brother watching you and tracking you. And then, of course, some people think that the absence of human involvement is also a little bit, I would say, creepy or problematic. So we believe, at least at our MyTrace effort, that the way we want to think about the digital aspect of it is an enhancement to the human process, that both of them have good elements that have to be combined together. So our goal of our nonprofit, which again is organized by some different members of the community, okay, is to stop the spread of COVID-19 by opening the contact tracing, but of course to preserve individual privacy. Okay, so contact tracing software is not the solution; it's just one piece of the puzzle, and we are working very hard to design this piece so that it connects to all the other aspects that have to do with public health. So what are the core values of our organization? We want to maximize the utility for individuals and public health. So we always want to think about those two different users. We want to maximize the privacy and security, that's point number 2, while preserving simplicity in the development process, that's point number 3, and also have an urgent type of agile development process. Okay, so 3 and 4 have a interplay with 2, because you want to have a technology that is very robust and tested, and at the same time, you want to maintain security. At the same time, you want to be able to be agile in terms of adding features that the government wants and public health officials wants. Okay, so we believe that many people benefit from this approach, right? Of course, the contact tracers, once they get the digital traces, they can actually do better analysis. The individuals, when they decide voluntarily to disclose their trajectory or their information to the contact tracer, then they need to rely less on memory, and they know exactly where they were. If you're carrying out the application, you will get a risk assessment that will allow you to figure out if you probably want to get tested or not, or you could be notified by the health authorities to do something. So that's important also to carry out the app. It's something that we need to actually talk to people. And obviously the health authorities have a panopticon to actually be able to think about how to prioritize their efforts. And that's kind of the value propositions of our effort. So now let's talk a little bit about the technology, how it works, and then the workflows. First, let's talk about privacy very briefly. So we are designing our app to comply with the privacy specifications of the provinces. Especially, we have looked at the Ontario and British Columbia ones, and also to the recently announced Privacy Commissioner's framework for assessing the privacy of COVID-19 initiatives. First of all the actions that the user takes in our app are consent-based. The use of the data is narrowly used for this particular application. We're a non-profit, we don't sell the data, we don't give it to anybody. Most of it stays on your phone, as you will learn, if not all of, basically. And then we're writing anonymization and the identification in the process. Also, we only store the trajectories in your phone for a particular time period defined by the health authorities, say it's roughly 2 weeks. So it basically means that we're not storing all your trajectory like if you were an advertising tracker or something like that. So there's roughly, and this is an overview of the type of protocols that one can employ, are the GPS solutions, which will be our version 2, the Bluetooth solutions, which will be included in our version number 3, and that many people have heard about the Google Apple technology developments that will allow to have very good Bluetooth interactions. And the reason that we have not added Bluetooth from the onset is that it's still weeks away from being robust, I guess, when the Google Apple release their interface and the co-epi developers can continue improving. And finally, there is an approach by our colleagues and friends at Mila that suggests a very interesting shuffling and blinding server approach that is kind of similar to the anonymous network called Tor, where data is delocalized everywhere. So it is maximal in security, but it increases complexity. So our path is to actually go from GPS and Bluetooth. As a matter of fact, we suggest to the health authorities to use Bob, because I'm not going to read all the elements of this table, but the talk will implicitly go through many of them. The point being here that Bluetooth is kind of a key exchange mechanism where you, as you get together with somebody, you can exchange the keys and you know that you were close to the person, but it doesn't have a geographical location, which is important for the health authorities and the contact tracers to find out where a lot of these exchanges are happening, or if they really actively want to say, oh, there's problems with this particular long-term care facility. So we intend to add to our application both GPS and Bluetooth. And then the moderate data privacy issue is the fact that our approach requires an anonymized and fragmented storage of the time-space locations of where the users were, the positive confirmed users were in the servers, which is in some sense potentially vulnerable to some malintent, some hacking. So this has to be very well secured, and it has to be also deleted after 15 days, hopefully. And a lot of work has to be done on that. And that's one of the benefits of the Tor approach, that because they delocalize all of this and obfuscate it, then that is not an issue. But on the other hand, you lose visibility by the contact tracers and the health authorities, in our opinion. So I think the best compromise is the GPS plus Bluetooth. So how does the workflow work? The platform that we are proposing contains 3 different elements. We mostly have been mentioning roughly this mobile app, but you could also think about 2 elements that are crucial, which are MyTrace Connect, which is the tool that the contact tracers use to look at the traces, the anonymized traces that are provided voluntarily by the COVID positive individuals, which eventually get aggregated in MyTrace View, which is a very good tool for health authorities to find out hotspots or to be able to make decisions or policy making changes if you see that dog parks are a problem or things of that sort. So these are the 3 elements. One of them is a mobile app and the other 2 are web applications. So I'll show you a demo later. So the way it works, let's think about the GPS plus Bluetooth idea. You download our application, and then at the beginning, you just press the button. It starts tracing GPS. As you run into different individuals that have the same application or compatible applications, you will be exchanging these Bluetooth keys that are rotated in time, so they are very anonymous in some sense. And then all of that is stored in your phone. But let's just imagine the unfortunate situation: you get diagnosed positive, then say the government will give you a 16-digit key or similar mechanism to activate the possibility of voluntarily sharing your trace with a contact tracer, which allows you to discuss with them which regions of the space you, for example, want to remove. Even though this is anonymized information, you might want to remove certain addresses, certain locations, or whatever. This is up to you how much you want to disclose. So you want the contact tracer work towards that workflow. And then they are submitted by secure servers to this server that will actually allow, MyTrace View will allow to have this global view of the situation. But also then that server stores that anonymous information that your phone is checking against, okay, periodically to find out if you were exposed to risk or not. So notice that your trajectory stays in your phone the whole time. Your phone doesn't have any information about you, like the application doesn't know who you are, etc. It's only when you provide the trajectory to the health authorities that then you're disclosing who you are. That's kind of like the big overview of what's going on. So I'm gonna spend the rest of the time going through some demos to show you how it will work. Okay, so first of all, we've been worked on a English and French solution that has a, lawyers have helped us. Mike Kaufman and his team have helped us develop like a very nice security policy, so basically this is how it will work. This is the real application. It's installed in many test flights and in Androids that we're testing. So you will pick your language and then move on to be onboarded with a simple process that explains to the user more or less what's going on. Of course, there's more information on the website and more information available, but it's important if a kid is 18 years or younger, then we need parental consent. That is a privacy policy. And then finally, there's a single button that says start tracing. That will be version 1 of our app, okay? Version 2, as soon as health authorities start working with us, will allow us to do the MyTrace connect and view pieces, because we need, of course, to work with them. But in the info, we have links to, for example, Empower Health, information of places where you can get tested, or links to Flatten, which is an epidemiology tool from the Vector Institute. Now, you might wonder what the contact tracer sees, and this is an early preview of the MIT Safe Spaces app that is similar to the Quarantine app that we're going to be using. This is an example of, for example, the path reduction, deleting certain GPS points that you don't want to be visible in the path, or in this particular case, again, filtering by time, travel, or date. So you can actually select different regions of time and space that the contact tracer and you want to go over, for example. You can see that bar selecting as you went along. And finally, the other thing that you will see is that if you want to select an area and remove it because you don't want to have your address or something like that, then you can safely do that with the health authorities. So with that, I just want to end to give time for the discussion. I think Q&A is going to be the most important piece of this presentation. And we have a hidden website. The website is not open, but we have basically a fully finished website ready for launch when the health authorities and us, if that happens, decide to go ahead. And on that note, I'm going to pass the soccer ball to the analysts, and thank you for the other panelists, and thank you for your attention.
Thank you, Alán. You may notice that there's already some questions building up in the Q&A for you. I would like to ask Ashleigh Tuite. Ashleigh is an assistant professor at the Dalla Lana School of Public Health, where she has been involved in epidemiology and infectious diseases and is an academic in this space. She is also on the Canadian Institute for Advanced Research Expert Advisory Group on Science, Technology, and Ethics. Has spent time at Blue Dot, a company you may know as having announced an unusual pattern of pneumonia in Wuhan 9 days before the WHO announced the activities. So Ashleigh, please lead, and you have about 5 minutes to ask the questions you want asked.
Okay, great. Thank you so much, and thank you for that presentation. I will start off by being very transparent and saying that I'm a little bit of a skeptic of the digital contact tracing apps, and I'm very interested to learn more about this. I guess for me, I have a couple of, questions or things that I think about a lot when I think about this. So I think, it's abundantly clear that to control COVID spread in the population, we need multiple tools, and we need to be innovative. We need to, there's not going to be a technique or a technology that's going to solve the problem for us. And so on the one hand, I think that, any tool that gets us a little bit closer to figuring out how we move away from, the very restrictive physical distancing measures that we have in place and allows us to get back to normal life is really important. I guess as somebody who works a fair bit with public health data and epidemiological data, one of the questions that I have around these types of apps is, in terms of their development, you really have two distinct users. You have the general population, so the people who are downloading the app and putting it on their phone and allowing you to collect that information. And you also have the local public health practitioners, so the people who are going out and doing the contact tracing and using this information to identify people who need to quarantine. And I'm curious to know, in terms of the development of the app, how you're working with local public health to figure out how this works, in terms of their workflow. I'm not entirely clear how the anonymized data works with the role of, a contact tracer who needs to go out and, identify contacts and tell them, to self-isolate. So I'd be curious to hear a little bit more about that. And I guess the other question that I have relates to, the reach of this app or the reach of these sorts of technologies and questions around effectiveness. So I think, this is a new technology and we don't actually know at this point how effective they're going to be. I think we have a couple examples from other countries who are deploying these, which suggest that uptake has been limited. And so I think, if we're going to expect Canadians to adopt this type of technology, thinking about, how are we evaluating these? How are we transparent in terms of, what we know right now? And, as this experiment unfolds, how do we feed this information back to the public so that we know? So there's a little bit of accountability and transparency in terms of how this system is working and if it's working. And, the answer may be that, this may not be as effective as we hope it to be. But I think, having that transparency and that accountability in place is going to be really, really important. And I think I'll maybe stop there just to give you a chance to respond. But thank you.
Thank you. So there's a few questions folded there. And if I miss one, just remind it to me. But let me begin by the contact tracer role. Yes, so right now, the provinces are talking to different proponents of applications. And we've been in contact with a few of the provinces and discussing back and forth what are the things they want. We haven't started sitting down with them to go through the workflows because they haven't selected who will be the application team that will work with them. And that's the process that they have acknowledged we need to start. If we were chosen or not, then whoever is need to start working with them. We believe, of course, when the contact tracer and when you disclose the path to your contact tracers, they know who you are and they see your path in the screen, okay? So they can use it as a tool to get at your contacts, okay? It is when the path is sent to the view, which is ultimately the server that the phones download, where the path is anonymized, completely anonymized, right? And broken up into pieces. So you don't know who entered a place and came out of a place. Now it's just volumes of times of space that are turned dangerous, so to speak, right? Or whatever, or they're flagged, okay? And also the contact tracers can manually add places that even though the traces are not there, they can decide to say, this is a place that I want to get a particular specific message, right? And the phones can go and check against that passively, okay? So it is a tool to help the contact tracers in that sense. And when we talk to the health authorities, they seem to know that, to understand that and to think about it that way. But of course, that's the reason why we're so excited about absorbing open tracers, this team of MDs that have directly contacts with the contact tracing community. So we're learning from them what are the protocols and the processes. So the more that we learn from them, we can prepare more if the health authorities choose us. In the issue of penetration, I think it's very important to emphasize to Canadians that whoever deploys these apps should be very focused on privacy and very focused on being transparent about what's happening. That's why our code is going to be released open source. It's a big consortium. We are following the MIT safe paths. As a big advantage of our app is that there is a large set of public health organizations around the world that are already coalescing around an effort led by a team at MIT And what we do is we have a parallel patching system to that code and also contributing code back to them so that we remain compatible with that health authority and others. So that's a big advantage of our app, I forgot to mention. But having said that, the point of this openness and the point of the messaging, it should be that, first of all, the code is open. First of all, this is a non-profit. And something that is interesting to try to tell to the public is that advertisers with cookies and all these things are already tracking you Google way harder than what we're proposing to do. So it's just, I think the messaging is going to be very important. But it is correct that you need large penetration, especially for Bluetooth schemes, to be useful. Less penetration for the GPS in the sense that with the GPS, you get the density, public health authorities get the density of high contacts. So GPS has utility even at lower penetration rates. But for the Bluetooth to be effective, you need to have enough density, about 60% penetration. So it's a question of how to do that. Last thing I would say, because I know we need to go back into Q&A, is that we believe that a big solution to the Canadians that don't have a phone is for the telcos to help us give them very cheap old Android phones with this thing already pre-installed. And there are solutions that we are working with, talking to people like Anteater, these very passive Bluetooth coins that exchange information that are not perfect because they cannot store information. They can only give beacons. But this type of kind of low-cost tools will also complement the cell phone technology. So I hope those answer some of the concerns.
Thank you. Ashleigh, do you have a follow-up?
No, I mean, I guess the one thing that brought to mind is also, you know, the other, I guess, concern here is disparities in reaching the vulnerable populations. And I think, you know, I mean, one of the potential trade-offs here is if there's a way to understand who are using the apps versus who is not, it potentially frees up time for public health to focus on underreached populations as well. But I think that, you know, sort of understanding who are using these and who we're missing is going to be really important. So,
okay.
Yeah, thank you.
Thank you very much. I'd like to turn second to Nick Beamster. Nick is the director of the Center for Data and Computing at the University of Chicago. He's a Neubauer Professor of Computer Science. He has awards in cybersecurity and network design, and so we're asking him to comment on this very complicated and important social network.
Thanks, Garth. Hopefully everyone can hear me. It's great to see all of you today. And really interesting presentation. Thank you very much for that. So as Garth mentioned, some of the areas that I work on relate to systems, networking, distributed systems, as well as security and privacy. One of the topics we look at is denial of service in the internet context. But actually, I wanted to kind of observe that the applications here have an interesting crossover between tech and the physical world, and there's actually a potential for a physical denial of service attack against the public health system potentially, right? So if the app, is performing contact tracing and then suggests based on those contacts that a huge number of people go get tested, then that could create sort of outsized load on the public health system as a result of how you've designed the app. And so there's lots of things to balance here, but how do you balance that trade-off of sort of timely notifications, scalable notifications, and maybe the inevitable flood of notifications that could occur, and what kind of impacts that might have on the public health system. And supposing that you have a way to rate limit that, I'd be interested to hear about how you sort of limit those, those notification rates. Let's suppose you make a mistake and there's just way too many notifications. Is there a way to fix that? Is there a way to remediate? Can you push updates to the app? Can you push new notifications? So I guess that's a multi-part question. I'd like to sort of first hear about, the sort of potential denial of service on the public health system and rate limiting. And then I'd like to also hear a little bit about updates.
So Nick, I love your question, and we have to consider it very seriously. If the algorithm, which at the moment we're not going to use AI, that's another difference with other teams. At the beginning, we're going to have a hard-coded set of rules set by the health authorities to really understand first what is that notification threshold. I think the WHO recommendation is something like being in the same place as somebody that tested positive 20 minutes or more, something like that, okay? So that will be, first of all, a set of hard-coded rules that will work with the health authorities to put. The user is notified not, another point I'm gonna just sneak in briefly, is not notified exactly the time and place. It's notified around this time, you got exposed, so that there's some protection of the other person, because you don't want to know, oh, is that bearded guy at the second cop? That's the guy that, you know, was coughing and it's him, right? There's problems of lynching that could happen. So you need to have a very careful way of notifying the users, and also psychologically, it's very important for them not to feel threatened by these notifications. So working with the public health authorities just on that aspect, which is not answering your question first, but the aspect that the notification is extremely carefully worded and sent to the user is very important. I haven't considered the issue of trickling them down, not to flood the testing system. Taking that note very seriously, we haven't discussed that in the team as far as I'm aware. So very good point that you're making about human denial of services on the testing centers. On the other hand, with digital tools, we could route the users intelligently to underutilized testing centers, right? Or you could suggest them as scheduling, right? Tell them, go and schedule your appointment and things of that sort, right? So I think the digital tool will allow us to actually potentially also maximize the usage of the testing centers and schedule them better if we can direct the users to them. So I'm taking notes on your suggestions. Definitely that's a part of the workflow that the health authorities need to give us more input. But I'm going to use your example of the physical denial of service. The app will be updated very constantly as the health authorities give us more information. And also, as I told you, there's an ability to send manual time-space notifications to the users, which might be useful for the health authorities. So definitely, I think fine-tuning of that is very important. And yeah, I don't want to spam or scare the population. Yeah, big point.
Want to follow up there, Nick?
No, that was an interesting interesting take. Do we have time for another one, or do you want to go to the next?
Short.
Either is fine with me.
Short.
One other quick follow-up, I guess, is another topic I think I see floating through the Q&A, and I'll bring it up too. And it's a great segue to, I think, the next discussion on civil liberties. I look at security and privacy a lot, and certainly, there's potential for, we've looked at sort of issues in tracking and de-anonymization, and I have a particular thing that I'd be interested in your comment on. So when you talk about sort of, this, de-anonymizing contacts with the tracing app based on a positive test, is it possible that the set of traces could be widely de-anonymized by, say, a high contact individual? And I'm really thinking in terms of an adversary here. Let's say I have a state actor who's like very interested in surveillance. Now it could basically just take, that state actor planting, positive test cases in certain parts of your contact graph. And then suddenly I know where, a whole bunch of my citizens and population have been at different points in time. My question, I guess, then is, could a determined adversary basically plant positive tests to de-anonymize the contact graph and just build a gigantic surveillance system?
I will put it the other way around. There's another attack in the other side. So first of all, because the contact tracers are the ones that approve it, give you a 16-digit code or whatever is going to be the mechanism to get the traces up, there's a human element before you can spam traces in the server. Sorry, positive traces. So that probably is a more unlikely attack. But one attack that could happen is what people, I used to be a player of Pokemon Go. I have to confess publicly to 300 people, because I'm a runner. So in Pokemon Go, people actually do GPS spoofing, and they just go in around and they say they were in different places picking up Pokemon. So that attack, which can be done in an Android phone, you could imagine being a user that saying that is scanning the city all the time and being everywhere. And then that user can match the positives, right? So that's an attack that we have thought about and considered. But then it's also defended because we have humans in the loop. This is why I love our approach that we have humans in the loop. I'm worried about approaches that are fully digital because you don't know what's going on. Here, the human will upload, first of all, that person has to be tested positive. If it's an adversary, maybe they pay some money to a doctor to be tested positive in a fake way, get this, and upload this terrible map that looks like they are scanning the whole city of Toronto, right? So then the contact tracing should say, who are you? You're Superman or something? And then they should, eliminate that path. So I think the human in the loop paradoxically helps us make sure that we don't have this type of weird attacks. But I would say the attack that you formally talked about is less worrisome to me than the attack I talked about. But definitely, we love to have people like you, and we have a lot of people already in different areas, but especially people in security, work with us. Last thing I would say about security, because I know we're going to move to civil liberties, Garth and the Vector Institute is helping us, and we have a call today, set up a code review panel that is going to be looking by several companies in Canada. It's going to be looking at all our code to make sure there's no security holes. EQ, our partner, is very good in security, and they will help us with this. But we want to have external viewers. And I would love to have a panel of people like you that are thinking about all the possible adversarial attacks so we can, do our karate to defend us. So yeah, thank you for that comment. And definitely I would love to have many phone calls. We have a workshop on Monday about security also, a whole day workshop. Our team is getting together to discuss these aspects.
Need to cut you off there. And yes, I need to move on to the
Thank you very much. That was fascinating. Thank you.
So our next discussant is Brenda MacPhail. She's the director of the Privacy, Technology and Surveillance Project at the Canadian Civil Liberties Association. And you may have heard her on CBC this Sunday morning discussing a number of these issues, including contact tracing apps. So Brenda, would you please ask a question?
Good morning, and thank you so much, first of all, for inviting me to be part of this panel. I really firmly believe in constructive, open conversations about these kind of controversial topics. And while it's a bit of a weight to be the civil liberties voice, I also appreciate having the chance to be here and raise the issues that we think are important. In the email inviting me here, Garth actually said, in the urgency of the moment, many people are making principled arguments without necessarily accounting for the other side of the coin. So I just want to make it really clear that my position is, I believe that you can understand both sides of the coin, and it's still necessary to continue to make principled arguments. And I'd take it a step further and say that people in Canada and everywhere else around the world deserve technological tools in these times that have passed through the fire of rights protective principled scrutiny. And this is exactly the kind of forum that can allow that to happen. So I appreciate you creating it. The other thing is that people deserve tools that support them in their goals to stay healthy and keep themselves and their loved ones safe. And that isn't necessarily tools that are designed in ways to put a little panopticon in our pockets. So that's the positioning. On to the questions. It seems to me that when I looked at and I had the opportunity of looking through your slides and an extended version of them in advance of this talk, and your phase 1 model struck me as being perhaps the most privacy protective and humanly supportive version of your vision, where you've got an individual who can choose to activate an app that allows for their contacts to be recorded on their own device. And at the point that they're diagnosed positive, it's up to them to reach out to public health and say, I've tested positive and here I'm choosing to share in a constructive conversation with you my contacts. And we can talk about which areas I would like you to take out of the equation and why. That just very basic phase 1 model seemed like it was a humanly supportive kind of tool. As you go through phases 2 and 3 and add my contact and my trace view, you add risks to individuals, you add layers where they have to trust in the program. in your anonymization and de-identification processes, in the ways that their information is going to be shared. So I guess the question is, have you done a necessity and proportionality analysis as you move up through the stages of the program, so that you've assessed whether or not the trade-offs that you're asking people to make and the additional risks you're asking people to accept in terms of their privacy and the sharing of their information are reasonable and proportionate to the benefit that public health and, you know, more broadly Canada will get from that sharing. So that's the first one. The second one might feel a little bit unfair, but because you've positioned your app as kind of a bridge between people and public health, I think it's fair to raise the issue that even amazing technical privacy protections built into your product can't address the social risks of, you know, introducing population level surveillance in some form. And people are worried about mission creep. And I think it's a fair worry because it took, what, 2 weeks for France to ask Apple and Google if they'd be willing to ease off on some of the privacy protections that they had envisioned in their, you know, attempts to support contact tracing. So is there anything you can do as you program, or do you do anything to think about what the social conditions are that are necessary for your app to work, and to take steps to design in ways that constrain the ways that your work might be misused? And then the very last question goes back to something that Ashleigh was saying, but I think that part of respecting rights in a responsible design process is asking the right people what matters to them. So you've addressed the fact that you are talking to people who do contact tracing to help figure out what would be helpful to public health. From a rights perspective, we have to worry about the fact that different people experience surveillance, even health surveillance, even necessary surveillance, differently. Different people might be included or left out. So have you talked to users in different groups, potentially of people who might be impacted by the app, to attempt to figure out where the holes are and sort of the ways that this can do what you say it's going to do and still remain protective of not just privacy rights, but the sort of whole range of charter protected rights that we would worry about in civil liberties, which is about freedom of association and mobility, which even though they're constrained right now, aren't completely wiped out, and, you know, and equality rights, which again, Ashleigh had also touched on. So those are the batch of questions.
Okay, let me just begin by answering the first one, and then the last one, and then the second one I will ask you to rephrase it a little bit. So the first one is, first of all the phases of our application have consent built in. Okay, so phase one, which is the one that you're talking about, the only thing it does, it records your traces, and that's it, right? Phase two, which is the one I think you're referring really, is you're able to provide it to the health authorities in a voluntary manner. I think your concern is when the health authorities anonymize it and then push it back to the phones to give a risk assessment. Is right? Trying to understand your question better. Is that your concern? That's what's going to happen later, right? Well, the user consents to that. Okay, they can decide, and this is a good point. They can decide just to keep their app with their trajectory with the contact tracer and not put it up in the pool of trajectories to be compared back to the users. Okay, that is still a decision they can make. Okay, but if those approved traces are not available, then there is no automated way of telling users that they might have been in risk, and therefore there's less benefit for the people that opt to have that capability of finding out if they run into somebody, say, at the LCBO store or something like that. Okay, so I would say that's the answer to the first question. That I think yes, I mean they have to consent to that as well, and then that closes the loop though. Otherwise, you don't get in your phone any way of checking against positives. I think it will reduce the use of the app tremendously. It will still help the contact tracers as a memory tool. It will be more like a diary. So maybe that's what some people will decide to use it for, just as a diary. Okay, so that's just answering the first question. The last one is an extremely good point. We expanded our team and we have now more people that are thinking about the medical aspects of it and the public health, but we don't have many people in our team or at all thinking about the surveys that you're talking about and thinking about how to expand our knowledge of how the public perceives us. So having people that work in this space join us as a part of our coalition, and we have hundreds of people connected, will be extremely welcome, because we don't have enough information in the latter question. Your second question, could you please kind of rephrase it for me, because I didn't understand exactly what your question was, and your second question.
Okay, I guess, are you confident that the current social conditions, which include at the moment relatively limited access to testing, are sufficient to support an effective use of this program, such that the exchange of information is worth it for people? And are you worried about ways that your work could be used by governments, for example, to create a sort of surveillance network that you're not anticipating, that you're actually trying to prevent by building in protections to your device, but that are possible? And again, when we look at the example of France asking Google and Apple to reduce the privacy protections that they initially announced.
Okay, so the first question is, I think we have to first treat, this is what we're doing, ventilators, say, test, we have to increase testing capability, and then trace, right? So that's kind of like the sequence of things that we need to do very well, I think, to get out of this. So we are assuming a world where testing is pretty advanced for this to be effective, because it goes back to Nick's denial of service type of scenario, where we don't have enough testing capability, and then we send all these people to be tested, and then we create a problem. So I think that's something that has to happen. In terms of how we see this privacy issue, that's why our applications, most of the time, unless you get sick, everything's in your phone, and everything doesn't have an identifier, right? So there's not an active, big brother watching you as you're carrying your phone. It's only when your phone receives these health authority notifications that you will be, sorry for these noises, you will be alerted, right? So I would say that protects you a little bit from that scenario, but definitely I think the MyTrace team, if we suddenly get some creepy requests by the Canadian government, we will have a big advisory board of reputable individuals that will help us decide if we comply with that or not. We're a nonprofit, and we also have our own agency. So I definitely land on the side of privacy, and if something creepy is asked of us, I will be very wary. But obviously, I think having people like you or people with your background that really think about these issues in our team will also be a good addition. So welcome suggestions of people we could add to actually be adversarials, not in the terms of the security adversarials like Nick, but adversarials in terms of the privacy concerns. Definitely we need more of that. We moved to develop a product, but we're not a perfect team. After all, I'm a chemist and a computer scientist. I don't work in that space. So a lot of feedback will be needed.
All right, I need to cut this off. Brenda, thank you for the questions. Thank you, Nick. Thank you, Ashleigh. Before we lose this hour, I want to ask a few questions from the audience. There have been a lot of very interesting questions. One of the ones that caught my attention had to do with the psychology of the users of these apps. Will you have individuals who over-trust the app and believe that they're protected by having it and maybe participate in more risky behavior as a result? Is this a phenomena that the app is responsible for, and how would you defend it?
We thought about it. I'm not defending it or not defending it. We did think about this false sense of security that the contact tracing apps could give you. Definitely, that's something that we thought about. I think Ashleigh called this an experiment. In some sense, there is an experiment aspect of it. There have never been these contact tracing apps out there, so definitely the messaging and so on will have to be adapted as how they see it being used. It might be possible that happens with certain subpopulations.
There's this technical issue between Bluetooth and GPS keeps coming up, and it always sounds like it's just technology, we should ignore it. But I believe the underlying question that people are trying to ask is it sufficient to simply know that someone was within 5 feet and there is a way to tell them that what your status is? Or do you need to know where they actually were in the world, even if that's fuzzy and saying you're in a building that has 100 floors? What is the true merit of having the GPS information available as well?
the user will not see the GPS information, just to be clear. The user in their phone, they will just see that they had a risk assessment, okay? Because for privacy reasons, we don't want the user to know where they met somebody necessarily, okay? They'll say maybe a few days ago you met somebody. It will be very vague, and the health authorities have to tell us how vague they want the notification to be. But that my idea is it has to be as vague as the health authorities want, so that people cannot know exactly where this happened. We believe the GPS tools are very important for the health authorities themselves to be able to see regions of space where these contacts are happening. Say it is the Bathurst subway station where a lot of this is going on. Then maybe you can do some intervention there and separate the people more, or things of that sort. I don't know, an example of that sort. So we believe the spatial aspect is important mostly for the health authorities.
Okay. I think that's a really interesting question here it's sort of back to Ashleigh's transparency issue. So in some sense, a new technology is being introduced. It's balancing impact on civil rights, risk in technology, and the benefit for health. And you don't have a controlled experiment, and you can't run this twice. We don't want to experiment on our people. We want to reliably provide value. So how are you going to have enough transparency into decisions like whether GPS was used and how it was used so that the populace trusts?
So of course we are moving really quickly as fast as we can. My team is writing a first Medium post explaining our positions on some of these issues. This workshop is going to be amazing for us to fine tune what we're going to say in that Medium post. We imagine as a nonprofit organization, we're going to have a regular communication strategy of what we're thinking about, kind of like a blog style, explaining what we're thinking as we go along, ways of reaching us and ways of discussing with the public, maybe seminars like these ones. The MIT SafePaths team has a weekly communication to people to tell us, the users of that platform, how are they progressing and what are they learning. And we had a call with them yesterday, one-on-one. So I think this time of open communication and trying to explain people that we're just humans trying to help and so on. I completely agree with the issue. That's why I'm very proud that the city of Ottawa went, wow, and they released an app in the city of Ottawa with Quarantine, with his 40M team already. And yesterday we heard Alberta release one. I think these experiments Alberta announced they're going to release an app. I think some of these apps will be very good learning for perhaps what's going to be the national or global strategy, right? So as local jurisdictions start experimenting with this, we will all be learning. And those are kind of like the data points we need. And some of them are going to mess up, some of them not. Maybe we will mess up terribly. We're humans. But the point is, as the collective learns, probably this contact tracing toolkit in the world will standardize and will kind of address a lot of the risks and balances that we care about. So I completely agree. This is an experiment, and we have a lot of worries that keep us up at night. It's not like we are like super confident about this at all.
So in Ontario, let me be selfish for a moment. A lot of the deaths are in long-term care facilities. Do you expect this app to provide any value in a long-term care facility?
We think that this app can allow you to know, for example, something we discussed within one of the provinces is the idea of selecting that long-term care facility and figuring out everybody that had the app and went there to tell them, that was a hotspot, for example, right? Another thing that we've been discussing with our team members is can the telcos help us give phones to these people or devices, okay? So that if they move out or somebody comes in and so on, we have the Bluetooth contacts, for example. So we need to kind of, Ashleigh was talking about the vulnerable populations. I agree, health authorities have to focus on them. And then if our tech can help a little bit, that's good, but maybe we can help on the other side, as she said, help on stuff that is outside of the facilities. So I would say we can help, but the health authorities also have a huge role there.
Okay, I think I'm going to wrap up right now. I think that this has been fun, but I think we probably all have a dozen more questions, but we probably don't have patience for a 6-hour talk. So thank you very much, Alán. I want to let the community know that we're planning to have more of these as the other apps agree to come and do a presentation, and please look for them and stay on our list, and we will be happy to invite you back for continued conversations. want to thank our sponsors, the Canadian government through the Canadian Institute for Advanced Research, and our partners at Amy and Mila in Edmonton and Montreal. And I want to thank the province of Ontario that has enabled Vector to come up very quickly, and our 45 sponsor organizations that work with us to find ways to be better with AI. Thank you all for coming, and we will be posting a recording and informing you as to where it is as soon as we can.